This is the 6th annual Uninsured Healthcare Best Practices Forum that the Blue Cross Community Trust has sponsored. We began holding these forums as a way to expand and best deliver care to the estimated 800,000 uninsured Tennesseans within our state's volunteer healthcare clinic community. And although the newly passed healthcare reform law will expand access to health insurance for an estimated 32 million Americans by 2019, there will continue to be a need to focus on the health care of those who remain uncovered by the system. This forum today is designed to bring all the relevant parties together to address these ongoing needs.
We all bring a piece, right, so we can come up with a whole that's larger than just our individual acts within our agencies and organizations.
At this forum, we're able to come together. We share stories. We tell stories. We are able to commiserate a little bit. But more importantly, we make plans. We're able to find new ways to address the problems of the uninsured in this state, and we are truly grateful for Blue Cross for making it happen.
During this forum, we examine who the uninsured population is, why they're uninsured, and what the consequences are of having no access to care. But more importantly, government, private industry, and academia come together to share best practices on how to expand that access and best address this population's healthcare needs.
Usually they're poor. Even if they're working, the wage they're earning is usually lower than those that are insured and employed. So they're more likely to be sicker when they come into the healthcare system. That's why also they have higher frequency of smoking, say, physical inactivity. They don't have availability and accessibility to healthy foods at the same level as an insured population in general would have.
There are more than 20 volunteer clinics across Tennessee, many of which are represented here today. These clinics are on the front lines helping the uninsured. One stellar example is the Church Health Center in Memphis, which has provided low-cost care to 70,000 Tennesseans since 1987.
Being uninsured leads to a lot of problems. The stories we see over and over again are people who, in the last few years with the economy, who've been working for the same company for 15 years. They now, however, have had their hours cut back to 24 hours a week. They no longer had health insurance, which means they no longer have access to the doctor. They can't afford their medicine. The bigger problem is that people suffer. Church Health Center, we take care of the people who work to make our lives comfortable. That they really are the backbone of our society. These are our neighbors. These are the people who you see every day, and yet if they do not receive health care, there's a certainly tremendous cost to them personally, to their families, but it affects us all. It affects our economy. It affects the quality of life of every person in this state.